Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you news as it relates to Bible prophecy and foretold by Yisrael Hawkins. One thing Yisrael Hawkins has been telling us is this COVID-19 is going to continue to stick with mankind until everyone has got it, and that is what we're seeing taking place right now throughout the United States. COVID-19, more COVID-19, and more COVID-19 as everyone continues to break previous records of daily average cases and hospitalizations. We're going to take a look at the fact that COVID-19 is on a continual rise, and cases of deaths related to it in the last month are rising, as well as the U.S. shatters once before records. Take a look at this next video concerning the rapid rise in coronavirus throughout the United States.
On Labor Day, we had 32,000 cases a day in this country reported. At that time, I was already saying that this was going to be the darkest months ahead.
The flu's not going to stop for COVID. Pneumonia's not going to stop. The strokes aren't going to stop. Nothing's stopping for COVID. So you already are going into a busy season, and now you have COVID on top of it.
On the eve of the election, COVID surging to all-time highs. Hospitals warning they may ration care. For voters, the pandemic is front and center as it continues to explode across the country yet again.
Every statistic is a patient.
We're all trying to keep our cool on the outside. On the inside, we're like, got so many patients I need to see.
For the first time, the U.S. surpassing 100,000 new COVID cases in a single day.
The moment that we are in is unique in history. There's really nothing that could have prepared us for this.
For the second time in just 2 days, the U.S. hitting over 120,000 new COVID cases in just 24 hours.
This is why we went into medicine, to take care of patients, to step up when others needed us. We took an oath to do so, and that's why we're here.
Tonight, coronavirus cases climbing in nearly every corner of the country.
What we're seeing now is what happened, a couple of weeks ago, and it's going to be getting even more because of this widespread spiking that is occurring.
We're going to look back one day and say to ourselves, oh my God, 100,000 cases a day? I wish we were back there at that point. This is not to scare people out of their wits. This is to scare people into their wits to understand that.
I think that every state's getting hit really hard, and you really can't walk by a TV screen without seeing a nurse or a doctor saying that they're overwhelmed and they're reaching capacity.
The whole reason why public health experts recommend practicing these preventive measures so we can avoid what we're seeing right now. Not only don't we want human suffering, but we know that we have a limited number of staff, a limited number of beds, a limited number of ventilators.
Let's start with the good stuff. Since we don't often have good COVID news to discuss, this vaccine news could not come at a better time.
Even if the shots were available tomorrow, Allison, we would still have months where we had to wait to get the benefits of those vaccines. Then the body has to rev up. It's like building, your muscles. You don't just go overnight to ripped and built. It can take several weeks. That's exactly what the immune system needs to do.
And that was only just the beginning, as all those records we're going to see here were broken.
That's right.
Well, currently in the U.S., 42 states have more new coronaviruses compared to a week ago, while 8 hold steady with cases, but no states have a decline in cases. April 9th saw a peak of over 34,000 weekly cases, followed by July 16th with 77,000 plus cases, and November 8th with over 126 plus thousand cases. And in just a week, 30 states hit a 7-day average record, with 22 states recording record hospitalizations as a result. Now, most states have an average positivity rate of 15%, but with some of these states having positivity rates as high as 40 to 50% in that range.
Yeah, those numbers are really, really high. Well, just recently, the U.S. has set yet another new record this past Friday for daily infections with 185,514 cases. Well, total cases in the United States now top at 10 million with 250,000 deaths. And currently, the United States is the worst in the world in regards to coronavirus cases. Now, it's gotten so bad that North Dakota's governor issued a new mandate requiring everyone to wear a mask, while New Mexico's governor is calling what's taking place in her state critical, stating in a press conference, she said, "We are in a life or death situation."
Well, in Utah, they had their deadliest day there since the beginning of the pandemic. It's been so bad there that staffed ICU nurses are maxed, causing the governor to call on 200 traveling nurses to assist with the already overwhelmed medical professionals. Now, infections throughout the U.S. now average over 145,000 cases a day, that was an increase of 75% in 2 weeks. Now, Rachel Fain, a respiratory therapist in Idaho, said, "At this point, it's a sign of disrespect to not wear your mask. I'm going to contract COVID in the community, unfortunately," she said. Now, the National Guard has been mobilized to Idaho to assist with the coronavirus response.
Well, Idaho's Governor Brad Little said regarding the COVID-19 crisis, it comes down to personal responsibility. Please wear a mask when you're around another person who's not in your household. Well, governors in Oregon, California, and Washington State are telling travelers to stay away as the coronavirus crisis continues to spiral out of control.
And we're seeing a lot more governors now chiming in and saying, hey, look, this is really getting bad. We're going to have to do something in our state. But we're going to see that they're actually saying we can't just focus state to state. We need to do it across the United States if we're going to try to put a stop to this. Well, in Utah, the number of COVID-19 patients has doubled in the last month. They have a respiratory triage set up in the parking lot of a local hospital as they anticipate a surge of COVID patients. Now, with a quarter of the state's test results coming back positive, the ICUs fill up, straining healthcare workers. Utah has become one of the many hotspots within the nation, despite the huge increase in cases, and even with some patients being hospitalized, many don't take the virus seriously. Now, a couple nurses from one of Utah's largest hospitals spoke to CBS News concerning their fatigue and the frustration as a result of the patients' responses.
That's right. One nurse said, "We're working super hard to get them better, and finally they wake up, and then the first thing that they say when they can communicate is that it's all a hoax." Well, meanwhile, in St. Louis, Missouri, residents are being asked to stay home. Dr. Alexander Garza, a chief community health officer with SSM Health, said in a press release, "If we stay on the path that we're on even just 2 more weeks, we will not have enough staff. We need to, of course, care for patients."
It's kind of interesting that even after the patients go through it themselves, they still wake up thinking this is a hoax.
Yeah. You think that they would take it a little more seriously, but apparently their mind is in a different place.
So, well, in El Paso, even inmates are being used, and they're being paid $2 an hour to load bodies into mobile morgues because coroners are so overwhelmed. And in California, cases have doubled in just 10 days, prompting the governor to halt most of the state's efforts to reopen and saying, we are now moving backwards and not forwards. Now, Michigan is also imposing new lockdown measures, limiting indoor gatherings. And while in Washington, the governor is calling for an immediate shutdown of gyms, theaters, bowling alleys, and indoor dining.
And you can see, too, as was mentioned before, and was a concern in the summertime with the winter months coming, not just the seasonal flu and how it might affect COVID-19, but people tend to move into closer proximity and do a lot more indoor things as the weather gets a lot colder. So this is something we're seeing governors take seriously and wanting to put that to an end. Well, Washington's governor said, if you act early, you can save lives. If you don't, you'll be swamped by a tsunami of this virus. Well, the virus continues to take an economic toll, as in Dallas, one food bank served an almost endless row of vehicles, saying that they fed 25,000 people, according to local officials that day. Well, shelves are empty in Chicago supermarkets as the stay-at-home mandate begins to take effect. And Dr. Brandon Webb in Utah said there is a big pushback over the state's new mask mandate. And he said, "It's no longer about politics. I have seen more human suffering in the hospital in the last month than I've seen in my entire career."
Wow.
Yeah.
Well, we're now going to turn to our field correspondent, Larry McGee, who has more on the coronavirus and just what exactly some states are doing to try to slow the spread. He actually has some of the records and how those are continuing, as we mentioned, to be shattered each day as more new cases and more deaths result. Larry, what do you have for us?
The rate at which the plague is finding its various hosts is now beginning to elicit adjectives such as aggressive and unrelenting. This is the language currently being used by the White House's COVID task force, as 1 out of every 10 Americans tested are said to come back positive for the affliction. All of this is heaping further exhaustion on the healthcare system, which has long since collapsed. The severity of the rate of infection has also produced tighter restrictions coming forth from state authorities, measures such as curfews, mandated masks, and cancellations of seasonal festivities. With close to 250,000 verified dead in the U.S. due to immunocompromisation and co-infections in the face of contracting COVID, the CDC issued a warning for citizens to forego traveling for the holidays. Severely understaffed hospitals have created a burgeoning market for traveling nurses who arrive to some locations to cheers coming from thankful crowds. Those same professionals express frustration regarding the disassociated and delusional notion that the pandemic is a hoax, all while the very real pressures of trying to manage the impact of the virus is bringing many of them to their breaking point. As for the CDC's earlier advisory for citizens to avoid traveling and remain home, millions of people have reportedly chosen to ignore that caution and to mark the holidays in their traditional fashion. Those interviewed by reporters say they get it, but people want to be with their families. Meanwhile, the states are having difficulty burying their dead. In Texas, the state's National Guard was actually called in to assist the mortuaries with the overflow of bodies. For YPN News, I'm Larry McGee. Good time, Jeff. Back to you.
Kind of shows at the end there still how people are not taking it seriously, having these burn your mask parties and just outright saying, kind of like that one person said, this is all a hoax, which as we can see from the healthcare professionals, it's definitely not. Many people catching this virus, many people dying from the virus.
Yeah, sadly. You always have a group of people who don't believe or take things seriously when they need to. Well, continuing this past week's timeline, the 25th, there were over 12 million Americans affected with the coronavirus, which was 1 million more than just 3 days earlier. According to the COVID tracking project, the U.S. saw 195,000 new infections last Friday, and there are now over 82,000 patients hospitalized due to coronavirus. Most sobering is the average deaths from the virus, which is at 1,641 deaths per day since Sunday, and states like California are trying to help flatten the curve by implementing a 10 p.m. curfew.
Well, on the 26th, the CDC came out with a serious prediction saying that the death toll in the United States could reach as high as 321,000 by mid-December. Now, already stressed hospitals could be overrun with patients at that point in much of the country.
That's right. Well, anticipating a large influx of patients after the Thanksgiving holiday, Chicago's Rush University Medical Center has set up a triage area in the lobby. Emergency room physician Dr. Mita Shah explains to CBS News this evening there are 19 patients waiting for a bed right now because we don't have any upstairs. There's a kind of overwhelming sense of apprehension as to what's going to come in the next 10 days.
Well, back in California, health officials are expecting a shortage of ICU beds that will be fully staffed by nurses over the next 2 weeks. Dr. Jim Keeney, who works at the ER at Mission Hospital, said, we have a full ICU of people with COVID on ventilators who are fighting for their lives. So this is real. Now, yesterday, the state hit a new record for daily cases at 18,350.
While states are ramping up their defensive measures against COVID-19, the Supreme Court, with new Justice Amy Coney Barnett, in discussing or litigating over people's rights, said the High Court ruled New York's congregation restriction on houses of worship was too strict, stating the regulations treat houses of worship much more harshly than comparable secular facilities, like stores and gyms.
Right. Well, even though the world is in the midst of a pandemic, millions of Americans did decide to continue their Thanksgiving tradition and travel to be with family. And with that decision, the nation is bracing for what health experts fear could be one of the most dangerous times of travel ever. Now, one medical doctor even warned that Thanksgiving will become the mother of all super spreader events due to nationwide family gatherings where people will not be wearing masks. And as you mentioned earlier, Katan, that the temperature, it's getting a lot colder, not too many people are going outside. This is the time of year where they're all indoors, where they fear this virus is really going to take off.
That's correct. Well, already things seem to be spiraling out of control. In just the past 2 weeks, 2.3 million people have been infected nationwide. That brings the total to 13,062,300 infections, according to Johns Hopkins University. And in the last 24-hour period, 2,000 Americans have died. Now, that's the highest single-day death toll in over 6 months.
Well, the CDC has called for an emergency meeting Tuesday, December 1st. Now, the purpose of the meeting is to allow an advisory committee to vote on which Americans should get the corona vaccine first, should one get approved by the FDA next month. Now, with the rapid surge of new cases nationwide, the U.S. is becoming desperate for a vaccine to help slow it down.
But will approved vaccines really bring an end to the coronavirus? Well, one Russia Today journalist Antov Krasovsky asked some of Russia's top virologists what's to come. There have been almost 2 million new cases of virus in Russia since spring, with Moscow having the highest number of victims. Now, parts of Russia are beginning to once again call for lockdowns for the next 2 weeks to prevent a greater increase in cases.
The Gamaleya Research Institute has been the first to declare they had developed a vaccine that will fight the coronavirus. Now, the vaccine was in the third phase of testing. However, President Putin declared Russia had a viable vaccine.
Well, when asked how this could be, Dr. Anatoly Alstein, a virologist at Gamaleya Institute, said, pertaining to the president's words, "It is politics, not science. I can just comment about the scientific part." Well, he continued, "We had the opportunity for quicker development. You take the virus out of the cell culture and clean it, and when you inject the person with it, the virus won't multiply."
Well, so this is how they are hoping to form long-term immunity. But Dr. Alstein does say how long and how strong the immunity is still the subject of study. It is still in question, but antibodies develop, T-cell immunity develops, and we can be sure that a person after vaccination will be safe for some time, at least for half a year, is what he said. So, that's only saying that this, if they do find a vaccine, which is successful, which many people are saying that there is no vaccine for this. They're saying it's only going to last 6 months.
Right, which seems to be the lifespan of the coronavirus anyway, after the antibodies are developed, which takes about 3 to 4 weeks. So really everybody's going to be in the same spot, whether they get the vaccine or not. Well, the virus is a difficult one to deal with because the doctor said it adapts to humans and evolves with each individual case. When asked how long it will take before we can come to the point corona stops killing people over 65, the obese, people with diabetes or cardiovascular disease, research supervisor Vital Zverev told RT, "This virus will never disappear from our population. It is another virus which we need to live with."
And the research supervisor, Zverev, also said that the issue is not with the virus, but with the human body itself. He said, you need to understand the coronavirus does not kill, it finishes you.
Wow.
And that statement there, it does not kill, it finishes you, that is something very interesting because it's the underlying health issues that are affecting, that people have before they ever get the coronavirus, that is really pushing them, or what's driving the deaths from this virus, because it's weakening, it further weakens the immune system of a person's body, so that those other health issues are now, the body just can't fight them off any longer, and that's really what has taken so many lives.
Yeah, and it's interesting how the doctor mentioned that it evolves. I think he quoted it evolves depending on the person. I mean, it evolves and it changes, or some scientists just say it mutates, which they have said there are several strains or mutations of the virus depending on the person and its adaptation. So we can see here, like you mentioned, that, you know, depending on the person's immunity to begin with will determine how the coronavirus affects them, or even if the coronavirus affects them.
And it reacts, so as you mentioned there, it's reacting to whatever health condition the person has. And from there, you know, they're finding that it's causing some to have the dementia. I mean, it's
blood clots.
The blood clots, that's right. So several different ways it is affecting people, all depending on what previous health conditions they have. So very interesting statement there that the coronavirus doesn't kill, it finishes you.
Yes, and even some scientists, most of them classify the deaths as coronavirus related.
Related, exactly.
That's right.
Well, if you'd like to find out more about these stories, contact the House of Yahweh. When you do, don't forget to request your free copy of the Prophetic Word magazine and monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. You can visit them at any of their websites by going to Yahweh.com, YisraelHawkins.com, and Yahweh'sBranch.com. You can also visit our website by going to YPNnews.com. For email, you can email the House of Yahweh at info@yahweh.com. And for all calls outside the United States, please dial the number on your screen. And don't forget the best aids to aid you in studying the sacred scriptures, the Yisrael Says and the Ask Yisrael programs, free online, 24 hours a day, 7 days a week. You can find those by going to YisraelSays.com and AskYisrael.com.
Well, don't go anywhere. Up next is another exciting message from Yisrael Hawkins explaining to all the viewers how they can avoid getting the coronavirus. From all of us here at YPN News, I'm Jeffrey Heimerman.
And I'm Katan Alexander.
Thanks for watching.